One of the problematic aspects of medical research is uninformed consent. In using disadvantaged population, informed consent takes a backseat to the betterment of humanity argument, which only seeks to legitimate the guinea pig-like style of such experimentation.
At the same time, white women are often being given control over their reproductive lives as they're seeking control. I shouldn't say they're given, because it's a struggle. They have to demand it. It doesn't just get given to them. They are embattled at every step. That very often what's happening to especially poor women and women of color is that there are systematic efforts to basically stop them from having any choices at all, any control over their reproduction, and ideally to just stop reproducing altogether. Once women have this ability to say no to pregnancy but still be sexual beings, it's huge, right?
The development of an oral contraceptive was a revolutionary concept in the Western world during the late 1950s. From the late 1960s to today, birth control has been regarded as a tool in the women's rights campaign to allow women to make their own decisions about when, how, and if they choose to have children.
Is pregnancy not in your plans for the immediate future? Are you looking for birth control you can count on but don't have to think about every day? You might want to consider Depo-Provera, the birth control shot. And like other hormonal medications, the shot may have some side effects.
FDA recently announced that a new black box warning is being added to the labeling for Depo-Provera contraceptive injection. The warning alerts prescribers that prolonged use may result in loss of bone density.
So the research was done in Puerto Rico, and the use of very high estrogen dosages was because at that point they really weren't sure what would be necessary, and they wanted to absolutely make sure that they could stop the pregnancy.
I think it should be probably more about curing, but I think today it's more about profit.
Curing. I mean, it's more of a moral thing. I think a lot of societies today put too much emphasis on profit and making money, and I think it should just be more on the humanitarian aspect of things.
It's a little bit of both, actually. Obviously, the goal is to cure disease, but you need to make a profit in order to keep going with the research.
I'd like to say it'd be about curing, but it's not. It's more about profit, because you can just see it more of like how the medicine companies, what they charge for it, and the monopolies that they hold.
The Guatemalan president says the U.S. committed a crime against humanity when hundreds in his country were deliberately infected with gonorrhea and syphilis more than 60 years ago.
Danger.
Whenever the patient needs to know what's going on with their medical treatment. They need to know what's going on versus the doctor saying, here's what we're going to do.
Like when you give consent for somebody to perform on you and you are informed of what the surgery is going to be?
Since 1990, when it was introduced worldwide, this has been a popular and affordable option for many women. Usually, 6 rod-like capsules are surgically inserted under the skin of the upper arm. They are removed after 5 years, a procedure that costs a maximum of 3,000 shillings.
After say 1 year down the road is when I saw that I couldn't take it anymore. The side effects were things like long menstrual periods. It kept on coming, and all the time it's spotting, so it was a bit hard for me to keep up with it.
It is these cases of severe side effects that prompted the United States of America and the United Kingdom to ban the drug in 2002 and 1999. It is also banned in Zimbabwe. But a random spot check by Citizen TV showed that leading hospitals in Nairobi still stock the drug.
I have not.
No, I have not.
No? No.
I have not.
No.
Never in my life have I heard of any of those. No, because I really haven't heard of anything to the effect that they are. I feel like they just kind of like let you know it's going to happen, and it's kind of at your own risk that you're doing it.
Maybe, I'm not too sure. No.
There are differing opinions about the strong reliance now placed on informed consent. In treatment settings, is it ever possible to inform someone sufficiently on the complexities of a surgical procedure or a treatment regime, so that a person really understands the implications of their decision?
The Nuremberg Code, written after the Holocaust in 1947, states with unmistakable clarity the conduct expected of a doctor or scientist performing medical experimentation on a human subject.
Some people, when faced with complex descriptions or multiple pages of information to join a clinical trial, simply sign consent forms without properly reading or trying to understand the information.
I want all the information available on this procedure so that I will understand what will happen.
I'm not interested in reading all this information, so I'll just sign the paper.
Much like the Nuremberg Code, the Hippocratic Oath, originally developed by Hippocrates in the late 5th century BCE, has been, and is, an ethical guide to conduct the medical profession that has been recited by those within the medical community for centuries.
Some argue that requiring informed consent to use some types of personal information, such as medical records, hinders research by placing more weight on protecting the privacy of the individual over enabling research for the benefit of society.
I must be asked for my consent for all uses of my healthcare information, or it's a breach of my privacy. We can't ask everyone for their consent. It's too expensive and time-consuming, but without this research we won't know how safe and effective this treatment is.
It is essential to a patient's ability to make an informed decision to have all available knowledge at hand.
It is highly problematic to do research on populations who are often poor, uneducated, and generally uninformed about medical protocol and the risks associated with medical testing.
A person can be considered capable of making an informed decision regarding their participation in a medical experiment only if they fully comprehend every important detail of the experiment.
From the method of experimentation to the particulars of any potential health effects.
Medical jargon and terminology is often difficult for an American with an average education to grasp, so it is easy to imagine how the incomprehensibility of the material is magnified when it is administered to a poor, uneducated population.
Clearly, if patients are to make an educated decision about medical treatment or experimentation, it is essential that the information be distributed in a way that they can fully understand.
We feel that this can be achieved by framing the information in the form of innovative and comprehensive media, making information regarding potential hazards concise and explicit, while reforming the style of medical practice so that the doctors routinely educate their patients as they prescribe them medication.
Oh yeah. More than 60 years after its establishment, the Nuremberg Code is not law. It is merely a set of ethical guidelines with its heart in the right place, but it lacks the power of enforcement.
We propose the creation of a new informed consent, which we term comprehensive authorization.
Will the Nuremberg Code be passed as a law, in addition to the Hippocratic Oath?
We propose that doctors create a personal relationship with their patients. We could implement this by limiting the number of patients a medical researcher sees,
while also creating conditions that foster the care of patients among doctors.
Creating different ways of getting information out, for example, through pictures if the population is illiterate.
Teaching while prescribing, educating while researching.
With the more comprehensive information provided to patients, decision-making could be a cooperative process instead of simply trusting the doctor to make decisions for you.
This would allow people of differing educational backgrounds to participate in their own care, which is empowering to a degree.
We want to get away from small print type of medicine. In doing so, we would have to create a new medical ethic in order to take the focus in medical research away from profit and toward people.
This would allow for better research. It would enable large research groups to team up and actually find solutions instead of focusing their attention on preventative measures that only seek to treat the problem.
If this new consent was implemented,
and patients could actually begin to trust their doctor, not because of her degree, but because of their friendship.
Unethical research could be avoided altogether.
For
the betterment
of science.